All right, everybody, why don't we get started? Thanks for jumping on today. We're excited you're here. Thanks for taking time out of your busy schedules to join us. We'll try to make this as valuable and as fast moving as we can and still have a good discussion about this data. This webinar is really based around the Incredible Health 2023 State of U.S. Nursing Report. We released that report last week, and so far I've had a lot of people very interested in this data. So we'll talk about the methodology of the study as we move through the presentation, but we believe this is the most comprehensive and in-depth study of nurses released every single year. So this, I think, will give all of us some really good information as we move farther into 2023. So with that, why don't we get started? Sarah Sweat, the Chief Client Officer in Incredible Health, has agreed to join us today and help us understand and translate and really dive into this data today. Sarah, thanks for jumping on. We appreciate it.
Thanks, McKay.
So with that, let's talk about the agenda. Nurse labor market today, we'll talk about some of the problems there, some of the things we're seeing at a macro level, and then we'll dive into the study results for the majority of the presentation. And then after that, we'll take your Q&A. We really want to make this interactive. And so please go to the Q&A area or the chat area, type in any questions or comments you may have. We'll address those either as we go, if appropriate, or at the end. The other thing to note is this is being recorded, and you'll have access to the recording within a few days of the presentation. So let's talk about the nurse labor market today. First thing, Sarah. So 1 in 8 Americans work in healthcare. It's been the #1 employment sector in the US since 2008. So there's a huge demand for healthcare, but we're actually seeing workers for healthcare that become a problem, and the shortage becoming a problem. So we estimate 1.1 million nurses short by the end of 2023. We're seeing about an 19% annual turnover in acute care nurses specifically. And that's a big deal. And then the one that is really shocking to me just consistently, no matter how many times I see it, is that 89 days number on the right. I cannot get over that that's the amount of time on average it takes to hire a permanent specialized nurse. Are you seeing that anecdotally with our hospitals that we work with too, Sarah?
Absolutely. Usually it's in that 80 to 90 day range before we have an opportunity to jump in and help. And, that's considering how desperate the need is. I know no health systems who are not interested in bringing more nurses on board, right? Like, this is systemic across the United States that this is a need. So even with that sense of urgency, it's just complex to navigate through the process and source those candidates themselves. And so our goal for our clients that use our platform is to be hiring in sub 20 days. So even just the savings from the hourly rate of a permanent staff versus travelers for that 69-day delta, it's usually enough to fund our whole partnership and create real hard dollar savings for the health systems. The faster we can hire, the less likely our clients are to be impacted by these statistics.
That's a great point. And I think to reiterate too, it doesn't mean you're like doing something horrifically wrong or failing if you're in this category. This is the norm. And it's something that we, of course, believe we can directly fix due to our custom matching technology that allow you to hire high quality permanent nurses in fewer than 20 days. And that's something that is supported by data across now, 700 and change hospitals.
That's
is
right.
Less than 20 days is easily the average. And in some cases, I know it's as low as like 14 days, right, Sarah?
That's right. Yeah, we love to see sub 20 days and have health systems that, by implementing many of our best practices and leveraging the platform optimally, they are rapidly decreasing those days and often being the first to offer in their market. Which we know is vital, because 61% of nurses are going to go with the first offer that they get, even if offers 2 and 3 are for greater compensation. So understanding and how important it is to be the first to offer, the lower we can get that number, the better.
That's a great point. I think the speed here is the key, and that's what we allow you to do, is to match with really high quality permanent nurses in your market that are already signed up for Incredible Health, that are already using it. and then hire from the platform in fewer than 20 days. So with that introduction to what Incredible Health is and what Incredible Health does, let's talk about the study a little bit. So study parameters, we gathered data, specific proprietary hiring data and employment data from more than 700,000 nurses that are on the Incredible Health platform. We also surveyed an additional 3,000 nurses to have some more in-depth data that we couldn't just do via the data from the platform. And this data was gathered in March, so it's brand new. This is hot off the presses. One of the first times we've actually presented this data in complete form. A couple of things just about the big picture that I think are important to understand at the outset. First and foremost, 80% of nurses say they plan on staying in the industry until retirement. That's a huge improvement. That's up from 55% last year. This number was pretty dire last year. Nearly half the nurses saying they wanted to leave the industry. Now that's up to 80% saying they're going to stay. But only about half would recommend nursing as a career. Now, initially, when I saw those two pieces of data, Sarah, I was like, those contradict each other. Why would 80% of nurses say they want to stay and then only half recommend it? What do you see when you see those two pieces of data there?
Yeah, it makes sense for me. I think our hospital and health systems across the country have been creating concerted efforts to improve working conditions for nurses, to focus on retention strategies. And so it doesn't surprise me that all of that effort that the industry has been creating has helped nurses feel like they can stay in the profession longer. But while that sentiment is a good sign for retention within the profession, it doesn't actually tell us anything about turnover for an individual hospital. And we know from Bureau of Labor Statistics data that turnover is actually increased in 2022. So the fact that only half of the nurses in our study are recommending nursing as a career tells me that we still have problems to address. And we need to think creatively about how we address that. I think our study has done a really good job of highlighting some trends that are contributing to that 54%.
I also think too, and we were talking about this a little before the call started, it seems like a problem if 80% say they plan on staying, but turnover within the profession continues to rise, as well as the inability to recommend it to others as a career. Seems like that has a long-term impact on things like job satisfaction, mental health, things like that as well.
It absolutely does. And when we're talking about things like mental health, we're also talking about the ability to deliver the highest quality care. We can't burn the candle at both ends, just as humans, and still deliver optimal or high quality output. And so starting at grassroots with some of this data around mental health and retention, I think is really important because this is a consistent theme that we've seen over multiple years in this study.
Yeah, and the mental health thing is, it's steady, so it hasn't continued to decline. In the 2 years prior to this, the number was plummeting, like it went down to 25%. And I think we were worried we were going to see that number continue to drop, maybe into the teens or 20% range. It's stabilized, which is good. But when only 26% of nurses say that they're in, good mental health relative to their job, that's not a good thing, right? Even though the number stabilized a little bit, and we hope it'll climb from here. But I think how low this number is continues to surprise us.
It does, and I think, just to flip that, what that essentially means is 74% of the nurses delivering care in the U.S. today are saying that they do not believe they're in good mental health. That's a scary stat to me.
Yeah, that is.
Because of how vital they are to care delivery and how critical it is for them to feel like they can operate at the top of their game.
Yeah, great point. This I thought could kind of set the table for the whole discussion here. And we don't want to view this as like a negative statistic. We want to view this as like opportunities to help nurses and improve the overall delivery of care model. So a majority of nurses, a big majority, 84%, say the healthcare industry is not acting quickly enough to address their main concerns. And we'll talk about what those main concerns are and potentially how to address those. But I think, again, the size of this number did surprise us in some ways.
It did. It's disappointing. But I think what it's really saying is there's sort of this lack of confidence from the nurses in our ability as an industry to improve their experience. So, we're not moving quickly enough to improve mental health. We're not moving quickly enough to improve patient to staff ratios. There's this lack of confidence in our ability as a healthcare system to pivot quickly enough to improve the working conditions and flexibility and all of the things that nurses are asking for. We're not moving fast enough. And so that we've lost a little bit of credibility and have to earn some trust back by taking some robust steps to create a work environment that does allow them to thrive.
Right. Let's talk through some of those things. So these are the main concerns for nurses. And these are factors that impact everything from mental health to job satisfaction to retention, of course. So let's go through these. Let me read through them and talk through them, and then we'll actually kind of go through the ones you want to highlight, Sarah. So 73% say they're still concerned about staff shortages. That is by far, no, it's pretty dramatic that almost 3/4 of nurses are still worried about staff shortages. 70% as a direct correlation, I would argue, of the first one are worried about personal burnout. Then you move down the list, 68% say salary and benefits are a major concern. Then you have a little bit of breakage in the data. There's a 23-point difference between 3 and 4, where say work environment is a concern, scheduling flexibility, and then limited career advancement at 25%. Now, if I'm a hospital system or if I'm a hospital and I'm looking at this, I can't go solve all these things tomorrow. So where do you start here? Like, what jumps out to you on this list? What are the low-hanging fruit items that can be solved, Sarah, from this list of concerns?
Yeah, that's a great question, McKay. I think as I analyze these results, I'm looking for themes, things that are the underlying issue that's leading to this stat, so that we can address that underlying issue. For me, I hear more questions from nurses about patient to staff ratios than I ever have before. And so those top 2 bullets are really correlated. They're concerned about patient to staff ratios and staff shortages because they want to deliver high quality care, and they know that they're impeded from doing that if they have too many patients that they're responsible for. It's a significant burden for them, and it's a lot of what leads to personal burnout for the nurses. So I think those 2 top stats are really pointing to me toward ensuring that we're creating an environment that allows the nurses to be successful and have an appropriate patient to staff ratio on our floors. So if this is, something that we're doing well, we want to be bragging about it. Compensation in any industry is always going to show up in the list of main concerns. But what I think is interesting about our data is that we're not really just talking about dollars and cents, but the unique benefits and perks that a health system offers. So providing really robust salary and benefit packages can help address this concern for nurses. The one that stands out the most to me, though, is 45% say the work environment is a major concern. And that's everything from the floor I work on, the nurse manager that I work with, the type of food that's in the cafeteria, the ancillary benefits that are available to me, and quite frankly, just the way that that patients interact with nurses in that environment. I talked to a nurse the other day, 20 years in the ED, and he loved it. His, had an excellent career working in the ED, but because of the level of abuse, physical and verbal abuse he'd received from patients, he said, "I've just lost my empathy for adults." And so now he's actually transitioning away from that hospital to another one to work in peds because he still can have empathy for kiddos and their families. And that speaks to things that were permitted or that nurse was exposed to in that work environment that made it hard for him to feel like he could work there and be well. So what we're really seeing when we say work environment is, can I work here and have wellness? And so wellness and including that in what we're talking about early, having tangible programs can make a real impact for nurses as well.
Interesting. Let's talk specifically about that top concern. The 73% are concerned about staff shortages. It's easily the number one concern. 93% of nurses say that staffing shortages have worsened over the last year. And we know that they weren't great going into 2022. So the fact that most nurses by a lot have said that they've actually gotten worse is concerning, I would say. And, there's lots of potential solutions for that, but this seems to be not only the sore spot in terms of concern, but also the biggest problem that hospitals and nurses are both wrestling with, Sarah.
Absolutely. I mean, this is not new, right? We have not had enough nurses, and that doesn't appear to be getting any better, right? That timeline on when we're going to be 1 million nurses short just keeps moving up. And so I think not only is this something we hear about every day from nurses and is easily their top concern, but the fact that they feel like it's degrading comes from a couple of different things. One of those is obviously just the patient-staff ratios and where those are out of alignment with their ability to feel like they can deliver high-quality care, because we're asking them to deliver too much care, and you can't have both. But I think also it's reflected in this data is the impact of travel nursing on the morale and cohesiveness of that floor. So, obviously travel nursing will always have a place, and it continues to be one of the most utilized staffing strategies for health systems, but it can erode that cohesiveness and camaraderie on the floor when we know that our permanent nurses are doing the same job, and they know they're making 2 to 3 times less in terms of an hourly rate than their cohorts who are travelers and may not have as much familiarity with the systems and with all of the aspects of the floor that a permanent staff nurse who is experienced and has been there for a while is able to deliver. And so identifying where that tension exists and how the presence of travelers either helps or hurts the morale on the floor and the ability to cover needs is an important thing to understand about your nurse population.
And that was one thing we dug into a little bit that I don't think we included in this deck is, the impact that a lot of travel nurses has on a floor or in a whole hospital to the morale of the permanent nurses. And it's a negative impact. Okay, compensation, that always comes up. It's always, one of the primary reasons people take and keep and stay at jobs. Only 33% of nurses say they're fairly compensated in their roles. And then 65% say they've considered a shift to a travel nurse role, primarily for a pay increase, because they see what those folks that are coming in for 6 months or whatever are making. This seems, it's hard to say like money solves all the problems, but it does solve quite a few of them for nurses, it seems like, as you look at the data. Is that fair, Sarah?
Yeah, I think everybody wants to be fairly compensated for their work. And when you know that you're working alongside somebody who's making 2 to 3x what you're making, which is the standard across the United States, it's hard to feel like you're fairly compensated for your role. And so I think some of the nurses who traditionally worked permanent have made the shift to travel nursing because they feel like they're almost forced into that position in order to earn optimally for the effort that they're putting in. Obviously, for health systems that are running on razor-thin margins, as most health systems are, that incremental cost for staffing is a significant drain on funding. And so identifying those places where we can create a robust compensation package for nurses, not just the hourly rate itself, but ancillary benefits, tuition reimbursement programs, relocation bonuses, offering housing stipends or, access to childcare or gyms at discounted rates. All of these things that we offer to our permanent nurses specifically make it less about the hourly rate difference between those two types of nurses and more about the benefits of being a permanent employee at that hospital, and help nurses feel more fairly compensated overall.
That makes total sense. And then we are seeing a really, I think, cool trend toward signing bonuses. So 48% of all nurse offers now include some sort of a sign-on bonus. That's up 14% over last year. And then the average bonus continues to go up. That to me is actually a really cool thing that can really decrease the time to hire. If you're trying to get someone to make a decision, just offering them 12 grand, that's not a small amount of money. And I think that makes people excited to sign on the dotted line. And, you probably have some mechanisms in there. If they don't stay for X number of time or whatever, you get a percentage of that back. Those vary. But to me, I like this trend, and I think it could add to the speed of hire as well as the job satisfaction, especially right out of the gate.
I agree. I think, the fact that half of the health systems are now offering sign-on bonuses of some kind, and that average is relatively meaningful, makes it easier for nurses to relocate. On our platform, we see about a third of the nurses coming from the existing geography or metroplex area of that health system, another third coming from somewhere else within the state, and another third coming from outside that state. And so as we look at that diversity, there's a significant number of nurses that are available, but they have to have some assistance in helping them get to a new area. So we see things like these sign-on bonuses, which can be delivered as a lump sum initially or staged based on, time. So, an initial portion at start date, another portion 90 days or 6 months in, to ensure that you're getting the ROI from that investment that you're making in the sign-on bonus. But it alleviates barriers for those nurses who have to relocate. It allows them to, offering discounted housing that's closely located, or some health systems actually offer a certain amount of time of free housing. It allows those nurses to meet other nurses from their floor, learn about the area. It just gets them there faster and delivering high quality care, so that they can meet other people and decide what area of town they want to be in, if they want to room with somebody who might be a good person that they work with to do that. It just creates a bit of a safety net for those nurses to make life-altering decisions like moving across the country or committing to a permanent position.
Interesting. I've also seen data that indicates that any employee actually sees let's use this example, $12,000 here on the screen, sees the value of a $12,000 bonus as greater than if they would have received a $12,000 raise in their salary. Just because they get all the money at once or a large portion of it, they're able to instantly go pay off a car or a credit card or whatever it is. And so it feels like a bigger amount of money than just getting that built into your salary, which might only equate to $300 or $400 a paycheck. That to me is an interesting way to handle this and to get people in the door. I like this approach. The opportunity and flexibility I thought was really interesting. So 90% of nurses say cross-training is important to them, and 96% said self-scheduling mattered in the consideration of a new position. So explain what those two things mean in this context, because I think some hospitals think about this differently than others in terms of cross-training or self-scheduling.
Yeah, I think these two items have really been constant themes in the data for the last couple of years. I think a lot of that has to do with the fact that the average age of the experienced nurse is lower than it was 10 years ago. So it's not uncommon for experienced nurses to have school-aged children, to be more reliant on, childcare, and they need a different kind of flexibility in order to make that the schedule of nursing work for their life. And then they're earlier stage in their career, or they have aspirations and want to grow. And so what they're really looking for from an employer is an investment from that employer to help them grow their career in the direction they want, true kind of career mobility planning, so that they can see the path to their next role. This kind of opportunity and flexibility dynamic is a constant among health systems that we see hiring the most on our platform.
Interesting. I love that. And then retention strategies. These are ideas that you can implement in relatively short order that will have an immediate impact on your actual retention.
It's true. I think these 4 things, if we take everything we've just shared in the data, these are the 4 things that I think as health systems focus on, we can reverse engineer retention for nurses. And so obviously we just talked about career mobility and career mobility planning and flexibility and scheduling. I think that's vital. In fact, so few nurses are not interested in self-scheduling that it comes up regularly when we talk to nurses.
Right.
And offering that, it doesn't have to be a super sophisticated self-scheduling tool if that's not available. We have health systems whose the nurse managers just meet at the nurse's station once a month and put the schedule down on a clipboard and say, figure it out, let me know when you guys have it arranged. So the nurses have more autonomy and control over what that schedule is going to look like and can ensure that they have their needs outside of work met, but are still working as much as we need them to do. And those floors are covered with seasoned staff. That allows us also to move into the patient-staff ratios. So ensuring that we're not only looking at patient to staff ratios as on a floor and have our standard for that particular type, right? If it's med surg versus if it's ED versus ICU, those are different ratios. But also look at the tenure of your staff. Are you populating based on an assumption of a patient to staff ratio of an experienced nurse when you have almost all new grads on that floor? That patient to staff ratio isn't going to be reasonable for a less experienced staff. So really understanding the makeup of those floors and if the patient to staff ratios that are best practice for that specialty actually work for the resources that you have on the floor. And then of course, we talked about creative and robust compensation packages. And this last one, mental health support, burnout prevention tools. I think this is vital. You have to have the conversation and allow the staff to feel that they are supported in raising those concerns, supported in having access to things that help them prevent that burnout. So whether that's access to a gym or a nurse community like the nurse community we have on Incredible Health, journaling tools, ensuring that benefits include mental health, access to mental health, ideally in a virtual environment. All of those things create a supportive environment for nurses that allows them to maintain a higher quality of mental health and therefore deliver a higher quality of care.
I love that. Let me ask you a question before we dive into the end here. What would you say to those hospitals or CNOs or whatever who say, look, this is a lot of stuff that we need to go tackle, and like some of these things, and we've done studies on this, right, Sarah, where there's an age breakage in nurses where over a certain age, some of these issues aren't as important as they are for younger nurses, newer nurses. What would you say to those health systems who say, look, these newer nurses have to adapt to the way this is done. We're not going to make all these wholesale changes in order to accommodate them. And I don't know that anybody's saying it quite that bluntly, but we do hear, vestiges of that perhaps. What would you say to those health systems or hospitals who might have that mentality?
I would say you have to listen to the voices of your employees. So one of the reasons that we do studies so frequently, and not just this annual study, but we send surveys to nurses, to recruiters on our platform constantly. And it's because we need, in order to pivot and be as flexible an organization as we need to be, we have to be getting fresh data and insights from the actual humans who are leveraging our platform today. And I think hospitals and health systems have to make that same investment. Ask what it is that's important to your specific population. And maybe it's different strategies. right? Maybe you pick one of these things that's more targeted at younger nurses and one of these things that's more targeted at seasoned, experienced nurses, but creating a custom approach to solving for these things and asking for ideas from the nurses on the floor about what would be meaningful to them. You don't have to do this entirely on your own. They've got great ideas on what's meaningful to them. We just have to ask the questions.
Love that. Love it. Okay, let's talk a little bit about Incredible Health here. And how we go about helping nurses and hospitals find one another. So 700 plus hospitals use Incredible Health to hire permanent nurses in, on average, under 20 days, some as low as 14 days. You can see some of the logos on the screen here, adding new logos every single month, which is awesome. And essentially what we do is the employers apply to the nursing candidates instead of the other way around. That's why nurses love it so much. And we're able to match nurses with the open positions with really cool tech, matching algorithms, data analytics, proprietary screening that allow us to move really quickly on those hires and give nurses and health systems a delightful overall experience. And I think that's really, really important. And then the nurses join Incredible Health for free, and they join for access to opportunities and jobs, but also free continuing education, nurse salary calculators, free career coaching, and a ton of other educational and content that they can use to benefit them in their career and their mental health. We have a whole mental health suite of content as well for them. There's a ton of opportunity for them there. And then the other thing to note, and you mentioned this earlier, is 68% of candidates are accepting their first offer, and 61% are accepting it even when their second or third offer has higher compensation. To me, Sarah, this speaks to the speed needed to make a hire more than almost any other statistic. Like if you're first on the scene, you're the first on the story, if you will. Like you're going to succeed. Even when other hospitals are offering more money. That surprised me when I first saw that statistic.
You know, it is what any sort of seasoned talent acquisition resource will tell you. Speed is your superpower. And that's usually because it's a highly competitive market right now. Nurses are rarely fielding one offer. They're usually fielding multiple offers from multiple facilities. And you want to be the first one to put a solid offer in their hands and shut down the noise from other opportunities because the chances are they're going to say yes to that first offer.
Yep, great point. And then you mentioned a little bit about the cost earlier, but this just saves you a ton of time and money. So imagine moving from 66 days to 19 days or 89 days to 14 days or 23 days or whatever. The amount of time and money that saves you is pretty dramatic. We've done some research and our data is indicating that, the average health system or hospital that uses us is saving a really significant amount of money every single year in their whole overall nurse recruiting and hiring process. Sarah, what does that data look like? And I know it depends on the size of the hospital or health system, but what do we see there in terms of savings?
It's really significant. One of the first things we do in every partnership that we establish is start tracking ROI, because it's our goal for our clients to be able to pay for the service from Incredible Health with the savings from Incredible Health. So even just thinking about the hourly rate difference between hiring a permanent nurse in 19 days versus 66, or removing a traveler from the floor, that 40 days sooner, what that's actually creating is an hourly rate savings. So anytime we're replacing what would have been a traveler rate with a permanent rate, there's savings every single day that happens. It's usually half the cost. And in some facilities, travel nurses rates are 3x. So the savings ramp up very quickly, and most of our clients see an ROI very early in their partnership, so that those hard savings are funding the rest of the partnership, and they're actually walking away with true funds they can use to fund other initiatives for their nurses.
It's great. Yeah, that's interesting. I never thought really about the savings of having more permanent nurses compared to travel nurses as well. I think that's great. And then this one actually is pretty cool. You might think that because someone's hired quickly, they leave faster. Not true. Nurses that are hired via Incredible Health have a 15% higher retention rate at 1 year than nurses not hired via the platform, which I think is very cool. And then this is just kind of the normal process that is followed, and what we do versus when the system gets involved, when the hospital gets involved. The key thing though here, and you mentioned this a moment ago, Sarah, is this does free up the recruiter for, more high skill relationship building work, and they're not just sending 80 messages a day trying to get people in the door. And that's really, I think, the value, one of the really significant values of Incredible Health is those recruiters can actually use high skill relationship building techniques they have, rather than sending unlimited messages and emails every day.
It's true. I think we have to make the best use of these experienced recruiters. Oftentimes, the recruiters that we work with have over 10 years of experience in recruitment in the healthcare industry. They know what they're doing, and they know how to sell their unique facility to the appropriate specialty and get them in front of hiring managers quickly. So we want to remove the burden for the front end of that process, eliminate administrative burden for recruiters so that they're really just leveraging their expertise to have conversations with qualified candidates and expedite them through the back end process with the hiring managers and on to offer.
Yeah, it makes total sense. Well, awesome. So that was kind of the baseline presentation. Why don't we take about 10 minutes here and address some questions? So we've got a few coming in here. I'll just go through these as they come in. All right. Back to the first slide, you mentioned the 18.7% annual average RN turnover stat. Where does that come from? We've been using 15.7 as ours. Just want to understand where your data comes from. I believe that one came from the Bureau of Labor, that 18.7. Is that right, Sarah?
That's right.
Is this information sourced from only hospital RNs, or does this include post-acute or nurses outside of the traditional hospital setting? I believe this only included information via the hospital, from hospital RNs. Can we get the slide deck and recording after the presentation? Absolutely, Margaret. We'll share the video recording with you. Specifically, we don't actually share the deck, we share the recording. Let's see. So Sue mentions, she just comments, I hear from our employees that long-term employees don't like the bonus. They want the hourly raise, but short-term employees want the bonus. That's interesting. Let's see. Ginger asked a question. What are you seeing between offer to start? So when someone gets the offer to when they start, what is sort of the standard time frame there, Sarah?
I think it varies by facility, but most often it's about a 2-week period. Some health systems are expediting the time to offer by actually making offers contingent upon some of the things they traditionally do at the back end of the process. So we never want to slow delivery of the offer, but if your system requires a number of references to be done or invites them to do a shadow day before their official start day, make that offer contingent upon successful completion of those things, and that helps fill the time between the acceptance of the offer and your next official start date with activity that keeps them engaged and ensures a high likelihood of start. We also stay connected with any nurses on our platform from offer accepted until their start date to make sure they have all the information that they need to successfully start the role. But usually it happens within about a couple of weeks.
Love that. And then 2 or 3 questions here just about like the type of nurses Incredible Health helps to hire. People are asking, do we help hire outside a hospital setting? What about post-acute settings, things like that? Why don't you just kind of lay out for everybody, the scope of the hires we are able to help with at this point in our company's journey?
Yeah, absolutely. So we are focused right now exclusively on nurses, but that could look like nurses, nurse practitioner, nursing leadership, All of those types of nurses are on our platform today and actively being hired on our platform. I would say the vast majority of our business is probably still at acute care facilities, but we do have home health facilities and post-acute settings that we hire for as well. Typically, we have those conversations with our health systems in the partnership strategy or sales process, where we're setting up the construct for what we're going to focus on. But optimally, we want to be able to ensure that those nurses can provide value to the health system and that they have the relevant experience to provide value in those settings.
Great. Awesome, Sarah. Well, thank you for jumping on. We know you're super busy. We appreciate you jumping on. Sarah does such a wonderful job taking care of our hospital customers and those 750 and change hospitals that are using the platform. So, Sarah, thank you. Any final thoughts or last words before we jump off here?
No, the only thing I would say is just thank you to our health systems. This is not an easy problem to experience, and it's not a straightforward problem to solve. Retention among nurses is vital for all of us as healthcare consumers in the United States. And so I know this is top of mind for all of our health systems. I'm appreciative of how collaborative the health systems that we work with today are in ingesting new data and being flexible and willing to try new things to help create this experience that retains the permanent nursing staff that are so vital to care delivery. So thank you to all of you.
Yeah, I love that. I would echo the same. Like, you're on the front lines of this thing in a huge, shortage for one of the most valuable and important positions you need. And we appreciate your consistency and willingness to, pay attention to this data, and we think it's important. So that's why we share it with you. So thanks again for jumping on, everybody. We appreciate it. Have a fantastic, Wednesday today. Have a great Wednesday and a great rest of the week. And Sarah, same with you. We really appreciate it. Have a good day, everybody. Bye-bye.
Thank you.